You're now 12 weeks pregnant, and from this point out, I feel like you start noticing the most significant changes. I'm Bridget Tyler. I'm a doula and a childbirth educator with my third baby on the way, and I'm doing a week-by-week pregnancy update to help you know what's going on in your body and your baby's rapidly growing body too. So make sure you subscribe if you haven't yet and hit the bell so you're always informed of any empowering educational videos that come your way. Now let's hop into week 12. At this point, your uterus is about the size of a grapefruit, so if you haven't started noticing external changes before, you probably are now or will start seeing some of that belly growth very soon as your uterus starts to grow up and out of your pelvic bones. Right now, your uterus is right about at the pubic bone, which you can find by going to your belly button and moving your hands down till you find the top of that hard bony structure. Now, usually prenatal appointments with your care provider are about every 4 weeks until the third trimester. So depending on your last appointment, you may have another one now at 12 weeks. If you are being seen at the hospital, you'll generally have your weight and blood pressure taken. You'll need to provide a urine sample. You'll get a chance to hear baby's heartbeat using a Doppler, and your OB or midwife will feel your belly for the size of your uterus. Each time you see your provider, I encourage you to check in with your experience with them. Your provider greatly impacts your pregnancy and your birth experience down the road. Ask yourself, how do you feel before your appointment? How do you feel in the waiting room as you're waiting for your appointment with them? How do you feel when you're with them? And how do you feel after your appointment? Your intuition is so powerful, and if you're with the right provider, you should feel a lot of comfort and ease during your appointments. If you're not feeling this comfort and ease, this is a really good time to look at other provider options. If you have a low-risk pregnancy and are hoping for an unmedicated birth, I would recommend seeking out the support from a midwife. I talk all about finding the right provider for yourself in my Built to Birth course, which you can check out in the description below. Now, at this point, you might be dealing with some headaches, and this is a common pregnancy symptom during the first trimester, but not necessarily normal. Again, there's a difference between common and normal. Headaches could be a sign of dehydration, low mineral stores, imbalance in blood sugar, stress, or fatigue. So make sure you're sticking closely to the basics of proper hydration and eating first thing in the morning and then every 3 to 4 hours with a snack before bed, each containing a carb, fat, and protein. An example of this would be cottage cheese with fruit, cheese with honey, eggs with potatoes, chicken with vegetables cooked in tallow bacon grease or avocado oil, or Greek yogurt with berries. When blood sugar drops too low, headaches are a common result. For stress and fatigue, reprioritizing your responsibilities, taking Epsom salt baths, going to bed on time, not looking at screens after the sun goes down or before the sun comes up, and starting a childbirth education course if your fears are surrounding birth can help a lot. I would also recommend seeing a Webster certified chiropractor. Chiropractic care during pregnancy can greatly impact the ease of labor at the end of your pregnancy and can make your pregnancy a lot more comfortable. Now let's talk about baby. They are drinking the fluid around them, which is a mix of pee and amniotic fluid. And this might sound gross, but remember it's sterile and it's super important to maintain a healthy level of amniotic fluid around them and for their kidney and bladder function. Baby is about the size of a plum and has all of their organs, their muscles, limbs, and bones in place, but they still have a lot of growing and maturing to do. Baby is also starting to practice breathing movements in their body, and their digestive system is starting to practice its functions too. Your baby and body are doing so much right now and will continue to as you wrap up your last week in your first trimester. With that being said, I'll see you next week in your first week of your second trimester. I'm so excited. I can't wait to see you there. See you later, Mama.